Welcome to Powered by Passion. Welcome to the Powered by Passion podcast series. In this exciting new series, we'll be exploring the vibrant world of nuclear through the eyes of the next generation of professionals. We are exploring the stories of young, passionate individuals who are shaping the future of the sector, whether in energy, health, safety, technology innovation, space exploration, and beyond. Nuclear is alive, active, and innovative, and the young professionals driving this change are the keys of its future. Every month, we bring you fresh insights from across the nuclear field, stories of personal growth, career challenges, inspiration, and the powerful impact that nuclear can have on our world. So, whether you're just starting your journey in nuclear or thinking about jumping in, this podcast is for you. Medical physics often works quietly in the background, yet it plays a crucial role every time a patient undergoes an imaging exam. From ensuring image quality to optimizing radiation exposure, it sits at the intersection of technology, safety, and clinical decision-making. In this episode of Powered by Passion, we meet Leticia Irazola Rosales, a medical physicist currently working in the imaging department at CBIR in La Rioja, covering nuclear medicine and radiodiagnostics. Alongside her clinical role, Leticia is also deeply involved in the professional community as chair of the EFOMP Early Career Special Interest Group. Her journey offers a unique perspective on what it means to work with advanced imaging technologies while keeping patient care, responsibility, and professional growth at the center. So Leticia, let's start with your journey. You hold a PhD in medical physics and now you work full-time in a clinical imaging department. What motivated your move from academic research to daily clinical practice? And was there a specific moment when you realized this was the environment where you wanted to make an impact?
So I think that what motivated my move was the desire to develop a broad and flexible professional profile, let's say. I wanted to be trained in all the three pillars: research, teaching, and the clinical practice. So I strongly believe that the research does not belong exclusively to academia. I can also carry it out within the hospital environment, often in a more applied and impactful way. Having these three dimensions, it gives you a more open perspective and allows you to approach problems more comprehensively, let's say. For me, it was both a personal and professional development process. In addition, I have always valued human interaction, and clinical practice allows me to have this kind of thing inside my life, and I feel it's a more direct impact on people's life, which is something that I find very motivating, and I feel it was not that way in the academia or the research. So I think I realized quite early on this environment where I wanted to make an impact. I wanted to do research, but I wanted to go into the patients. So even before starting my PhD. However, the opportunity to pursue this doctorate, it came when I did my master, and okay, I say, yes, I will go for that. But I didn't want to miss the clinical part. At least I wanted to try it. So eventually I decided to stay in the clinic and to make my trainee. And then I discovered that the clinical practice allows you to fully develop the three pillars. So I think that was the point I decided to stay in here instead of the other place.
Talking about imaging as a first step in care. Imaging is often a first step in patients' diagnostic journey. From your experience in nuclear medicine and radiodiagnostics, how does a medical physicist contribute to ensuring accurate and reliable imaging in clinical practice?
So I think we often work in the background. So usually medical doctors, nurses, and so on, they don't know about us. but it's an essential work because we have to ensure the accurate and reliable imaging. So I think it's something that it's beside the important things, but it's still important. So let's say the most important is always patient, but you can treat something that can be diagnosed. So you have to ensure this reliable imaging. So one of our core responsibilities is performing this quality control of the equipment. But beyond these technical checks that can be done by the industry, a key contribution is to understand how this machine works and what the technical and the clinics they need from the machine. So you need to know the technical parameters and also the way of imaging protocols are being used in the real clinical workflow. So we can this way implement these improvements that can optimize the image quality, but we have to get sure that the dose that the patient is receiving is not increasing. So it's like a compromise between both of them. And for that, you need to be inside the clinic, you need to talk to the doctors, the clinicians, and also the technicians from the industry. So we kind of manage all these people, but always, as I say, in the background.
Alongside your clinic role, also you had an active role in chairing the IFOMP Early Career Special Interest Group. Why did you decide to get involved in at the European level, and what do you think early career medical physicists need most today?
So I think it started somewhat by a chance, because at that time I was trying to become a teacher at the university in Spain. And here we need like an accreditation. So when I sent my CV, they told I need to get a stronger outreach and dissemination component in my CV. So it appeared this opportunity of becoming a member in the IFOMP. It was in the social, let's say, or in the media department, let's say, from IFOMP. So I present my CV and I was encompassed by the Spanish Society. So I get accepted, and then I said, okay, I can try to help on this. And then they offered me also to participate as scientific committee in the Congress, and I felt I was not that professional to be able to perform that job. So I told the past president of the IFOM, okay, I think I'm not useful for this, but if you need any help on anything, I can be there and I can support. So he had this idea of the young group, and I think it was really great. We tried it in the Congress, and that's how I started to work in the youth path, let's say, in the younger path of IFOMP, and it grew so fast. So we created this group and we started all of our, let's say, partnership with the other societies. So based on my experience, I feel that early careers, they need a stronger sense of unity. So we need the feeling that we are working in the same field, we are facing similar challenges and growing together. You know, when I started in the IFOMP, I felt I was the only early career, let's say, that was involved and that wanted to do these kind of things. And then not. There were many people that wanted to become a member of the steering committee. So I realized that maybe in Spain, maybe in Malta, maybe in Germany, they are not that amount of medical physicists that are early career. But if you put together all European people, so we are a lot of people. So I feel we are still missing an essential human component. So now we are very social media oriented, I feel. We need to be in contact. We need to trust in the other persons, and for that, face-to-face, I think is ideal. So in most cases, the relationships in the past, they were built this way, face-to-face in the conferences. And now we assist to webinars, we assist to the conference, but it's online. We make this course, but it's online. So we have to lose this fear to get into the people and to share these experiences, to see that we are not alone and the problems are all the same within all Europe. But I think that the early career groups are very aware of this, and they are doing these soft skill things, but maybe sometimes we are oriented into our future and not soft skills on how to connect with other people that it's in the same place, let's say.
Yes, indeed, as you said, the visibility mentorship, but also community building is very important for these and other fields. And as also, like many other nuclear fields, medical physics is evolving. What changes would you like to see for the next generation?
I would like to see that this medical physics they feel more supported, more visible, and more connected from the very beginning of their careers. I think we should not be alone. We are never alone, I know, but you don't need to apply for a mentorship to show that you are not alone. I mean, you have a lot of colleagues in your society, in IFOM, and also in other societies, because sometimes we are like medical physicists and we don't open to other ones. So this collaboration, this nuclear collaboration, let's say, has opened our umbrella from IFOM, and I think that we can feel that we are never alone, and that even if we are medical, we can also work in other fields. Besides the academia and the industry, there are other research fields that we can see in this kind of collaboration. So I would like to, for this early career, to see how they lose their fear to ask questions, to talk to other people that it's not in the same field, and to recognize that this is a broad profession and we have to open our mind, not only in Europe but also with other society. And for that, I feel that training and mobility are essential. So just feel free, no fear to ask things and to know other people and to go into face-to-face events.
Fantastic. And then to conclude, maybe some advice also from your experience. So you previously mentioned also soft skills, and for students or young professionals considering medical physics, what would you encourage them to focus on beyond the technical knowledge?
I will encourage every career, I think, to focus on developing these skills and personal confidence. I think that communication, team building, and the ability to explain complex concepts clearly are as important as the technical expertise, especially in the clinical environments. I think that they have to open to the clinical doctors, to the nurses, to the technicians. So they have to ask. Never be afraid of asking silly questions, because no question is silly. You just want to know, want to open your mind, and for that you need to start from the basics, from the very beginning. So I think that my tip will be always to ask and always to try what you want, because as I said, I've started my PhD and I've started in IFOM by chance. I just send an email and say, let's see what happens. So we don't have this kind of confidence in ourselves if we are early career, but send an email is free. No one is going to be ugly with you on an email. I've experienced this from the very beginning, and I think that with each response of an email, I make myself bigger and bigger, not in a professional way, but in a personal, because you always learn something from the people that it's talking to you or what is typing to you. So I think just this, not to feel silly, not to feel this fear. If you want something, you have to try it, because if not, you are going to be in the beginning, you are not young, you are senior, and you didn't try it. So just try.
Leticia's experience highlights a side of medical physics that is often invisible to patients, yet essential to every imaging exam, making sure that advanced technologies are used responsibly, safely, and meaningfully. Our daily work shows how medical physics actively support clinicians, advise on optimization and protection, and help ensure that images truly serve their purpose, improving diagnosis and patient care. Alongside their clinical role, our involvement in IFOM reflects a strong commitment to professional collaboration and knowledge sharing across Europe. An episode about medical physics where precision, people, and responsibility come together. Thanks to our listeners for joining us for another episode of Powered by Passion. Powered by Passion is co-organized by the European Nuclear Society and the European Nuclear Society Young Generation Network, IFOMP Early Careers Group, the International Radiation Protection Association YGN, and the FuseNet Association Student Council. The PROS-YGN collaboration is set up with the support of ENN2+ project, the largest and most integrative nuclear education and training efforts up to date in nuclear ENT. ENN2+ is funded by the European Union.